June 27th is National HIV Testing Day. ABC 7's Alex Redmond joins us with information on why testing is the gateway to prevention and care. Alex.
Thanks, Haley. More than 1 million people in the United States are living with HIV, and 1 in 8 people don't even know that they have the virus. There are 50,000 new HIV infections per year in the U.S., according to CDC estimates. Florida's numbers are among the highest.
The Suncoast numbers are rising. The Suncoast has a great deal of senior citizens who are not being tested. Our young population, the numbers are growing.
CAN's Director of Advancement, Scott George, says education is the key to prevention.
High school children and junior high school children are not being informed about HIV, STDs, hepatitis C.
George says in order to provide services including testing to a growing population, CAN is expanding the existing building, adding 2 additional off-site offices, and has opened a headquarters in Palmetto. CAN's education department says George offers HIV testing in 8 counties.
We were involved in the St. Pete Pride Parade. We picked up a number of positive people in our testing van.
CAN's Chief Medical Officer, Dr. Vilma Vega, explains the importance of knowing your status.
If you're negative, it's a feeling of, wow, you know what, empowerment. Okay, I'm negative. Well, I want to remain negative.
Then, says Dr. Vega, you can take steps to protect yourself.
What I call the ABC policy, which is the abstinence, be faithful, condom use.
If you're positive, says Dr. Vega,
you want to save your immune system for as long as possible. The earlier you get tested, guess what? You'll never die of AIDS. You're probably more likely to die of things like other complications of other diseases.
Getting tested is simple.
One of the things that people would have to do is fill out this paperwork in which you just put your details down here about your health, where you live, with a quick little prick of the finger. No, it didn't hurt at all. Not bad.
And now in the 2016 Florida statutes, it actually says that all physicians are testing for this during their initial physical exam. So if you go in for your annual exam, guess what? You're going to get all your labs plus an HIV test.
People, says Dr. Vega, should get tested.
Whether or not you were young or you're 90. I have had patients up to age 95 who are HIV positive.
And ABC 7 just learned that AIDS activist and Sarasota resident Jack Cox passed away. Cox lived with HIV more than 30 years and was an integral part of CAN and a much-loved and respected member of the LGBT community.
And Alex, you mentioned that doctors will be often adding this onto the annual screening that you go in to have your blood work done. What if a patient doesn't want to have an HIV test added to that?
Right. If you absolutely don't want your test done, then there is an opt-out. So you just tell the doctor you want to opt out. But why on earth would you not want to empower yourself by knowing your health status? Because then you can protect yourself.
That's true. Thank you, Alex.